Constance.
To ask the Scottish Government how it is supporting suicide prevention work in the Almond Valley constituency.
Minister Claire Hawkey.
In August 2018, the Scottish Government published its Suicide Prevention Action Plan, Every Life Matters. This sets out 10 measures to continue the strong decline in the country's rates of deaths by suicide. It has a target to reduce the rate by 20% by 2022 from a 2017 baseline. The approach to suicide prevention work in West Lothian is currently under review, and once this review is complete, a new strategy and action plan will be developed. Action 1 of the Suicide Prevention Action Plan commits the National Suicide Leadership Group to make recommendations on supporting the development and delivery of local prevention action plans and is backed by £3 million of funding over the course of this current Parliament.
Constance.
Thank you, Presiding Officer. Minister, Neil's Hugs is a charity in my constituency that supports families and friends affected by suicide. And they say that our top priorities must be to ensure that no one who has attempted suicide should leave hospital without immediate follow-up support. And also, we must reduce waiting times for child and adolescent mental health services. So given that NHS Lothian are a poorer performing health board in this regard, how will the Minister ensure that we do more earlier to prevent poor mental health and suicide?
Cabinet Secretary.
I'm aware of the charity that Constance speaks of, and Donna Patterson-Harvey, the Chief Executive of Neil's Hubs Foundation, has been involved in the lived experience events hosted by the Health and Social Care Alliance for the National Suicide Prevention Leadership Group, and I thank her for her participation in that, as well as others with lived experience. The member will also be aware that last year the Scottish Government and COSLA announced a joint task force on children and young people's mental health, and the task force is examining our whole approach to mental health services. Specialist clinical services are not the whole answer, and other services in young people's lives are vital to provide practical and emotional support, including education, social work and the third sector.